All right, compliance and resistance explained in terms of waveforms. This does not include loops, which are different. I apologize that it's a little small. I'm going to send you the actual sheet so you can look at it and print it and all that. But let's go through it. Hopefully, this will like simplify things and make them streamlined and make sense for you. So start with the top left. So dynamic compliance. Anytime we talk about compliance, we're talking about volume over pressure. So dynamic compliance is calculated or taken during active airflow from the vent, and that reflects the elastic properties and the airway's resistance. So because it contains everything, including resistance of the circuit and all that stuff, you take the total pressure, so peak inspiratory pressure, or the PIP. So dynamic compliance is tidal volume divided by the difference between PIP and PEEP, or your drive pressure. Okay, so the defining waveform characteristic is the PIP. So dynamic compliance, PIP. Things that increase your dynamic compliance, if there's any improvement of whatever interstitial lung disease the patient has, a relief of obstruction, and if you give a bronchodilator or suction or clean out the tubing if it's got condensation, rain out, secretions, a kink, anything like that. Things that will decrease the static compliance: ARDS, pneumonia, edema, fibrosis, bronchospasm, mucus plugging, kink tube, clogged tube, etc. Okay. Troubleshooting for increased, decreased dynamic compliance would be to give a bronchodilator to suction and to make sure that the circuit is clear. So dynamic compliance is PIP, period, the end. Static compliance, that is the plateau pressure minus PEEP, or the drive pressure between the plateau and the PEEP. So if it's volume over pressure, then tidal volume divided by plat minus PEEP. So the definition of static compliance, that's when the lung thorax distensibility measured when there is no flow from the vent. So when you do the inspiratory hold. So the defining waveform characteristic is your plateau pressure. Okay. Things that increase your static compliance, any improvement of the alveolar or interstitial process, if you have ARDS or edema, um, any kind of improvement with that, recruitment maneuvers, neuromuscular weakness and flail chest actually increase the static compliance when you know it shouldn't. Um, but things to keep in mind: things that decrease the static compliance. So that's the compliance of the lungs themselves. So anything that stiffens the lung, ARDS, pneumonia, pulmonary edema, any kind of fibrosis, atelectasis, a decrease of surfactant, hyperinflation, things like that. Um, Troubleshooting a static compliance issue. If it's a low static compliance, you can always add sedation, increase PEEP, diurese if they have fluid, or prone them. So put them on their belly. If they have a high static compliance, then you can decrease their tidal volume, see if there's a neuromuscular issue, see if there's a flail chest possibility, stuff like that. So, volume over pressure, dynamic includes everything, static is just the lungs from the plateau pressure, dynamic is PIP, static is plat. Okay? And then your raw, that's the difference between the PIP and the plat divided by your flow. So resistance of the airways, um, refers to pressure differences that are required to generate any unit of flow through the airways. So your pip minus your plat, that's actually your trans airway pressure, going back to 107. Okay, so pip minus plat over flow in liters. Factors that increase resistance, well, lots of stuff: asthma, COPD, bronchiolitis, bronchospasm, secretion, small airways, small endotube, clogged tube, too high of flow, things like that. Factors that decrease resistance, well, if you give a bronchodilator or suction or clear out the tubing, clear out the filters, things of that nature. Troubleshooting for resistance, same difference, all the factors that decrease it. Make sure the circuit is clear, give them a bronchodilator, suction, increase humidification, consider systemic steroids, consider increasing expiratory time through increasing flow and decreasing the IDE ratio, consider decreasing the rate, and then if all else fails, consider changing to pressure control ventilation. So I don't know if you can see the cursor. I kind of hope you can, but if you can't, I'll try to explain it. So on the left, we've got pressure over time. So our example is we've got ACVC, tidal volume of 500, PEEP of 5. Okay, so here is a tidal volume breath. So nothing special. We got a PIP of 20 down to the PEEP of 5 to get 500 for a tidal volume. So when you're looking at compliance and resistance trending, it's all dependent on the tidal volume being consistent, okay? So for all of these, I've got a tidal volume of 500, which is set. So let's take the first one. First one, we've got a PIP of 20. We do an inspiratory hold for a plateau. We get a plat of 15. The difference is 5, okay? 20 minus 15. Pip minus plat, go up here. Pip minus plat, that is your resistance. So this distance here is resistance. The raw of 5 is not the actual resistance. So resistance is not 5. But you can use the difference between the pip and the plat when you're trending resistance over time. So here we've got a raw of 5, a pip of 20, and a plat of 15. There's your baseline inspiratory hold. Let's do another one. Pip of 20, plat of 10, with a tidal volume of 500. So what that means is, so the pip stayed the same. If the pip stays the same, then the dynamic compliance stays the same. If the difference between the pip and the plat increases, that means that the resistance increases. So here we've got a difference of 10, so we've got an increase in airways resistance, or some sort of resistance, okay? And the plat of 10, that is your static compliance. So your plat minus PEEP, if the plat went down, then your static compliance went up. It's an indirect relationship. If the pressure goes up, the compliance goes down. If the pressure goes down, the compliance goes up. So here we've got a decrease in the plat from 15 to 10. So the static compliance, increased. The dynamic compliance did not change. The resistance increased. Okay. Next one, pip of 20, plat of 18. So we've got the pip staying the same. So the dynamic compliance stayed the same. The plateau, in this case, increased to 18. The plat goes up. That means the static compliance went down. Okay. And then you can look at all the factors that would make that happen. However, the resistance, the difference between the two, that decreased. So we have less resistance, but we have a worsened static compliance. So what that tells you is you can assume that in the case of this trend, the actual lung compliance got worse, but it is not a resistance issue because the resistance actually improved, right? So always equate your PIP with your dynamic, your plat with your static. Let's move down to the bottom row. Same difference. Pressure over time, tidal volume 500. Here's a tidal breath. Here's the next one. We've got a PIP of 25 and a plat of 20. So that is your baseline. PIP of 25, plat of 20, with the difference, the raw difference being 5. All right. Next inspiratory hold, we've got a PIP of 30 and a plat of 25. Okay. It's hard for me to even see this. With a raw difference of 5. So in this case, the PIP went up, so it required more pressure from the ventilator to reach the same tidal volume. So if the PIP went up, the dynamic compliance went down. The plateau also went up from 20 to 25. All right. So that means that the static compliance also went down. So this is a worsened compliance issue, both dynamic and static, not a resistance issue because the difference between the PIP and the plat remained 5. Next inspiratory hold, we've got a PIP of 20 and a plat of 15 to get your tidal volume of 500. So maybe you suctioned. Maybe you gave a bronchodilator. Maybe there was crap in the tubing and you cleaned it out. Maybe the filter or the HME was clogged and you replaced them. Either case, your PIP went down. So if the PIP went down, the dynamic compliance went up. The plat also went down, 25 to 15. So your static compliance went up. So both dynamic and static compliance went up in this case from going from here to here. The raw at 5 remained the same. Take the last one, PIP all the way back up to 30, raw of 5, plat of 25. All right. So we've got let's say we're back up to 30. So your dynamic compliance went down because the PIP went up. The plat at 25 compared to 15, the plat went way up. So your static compliance went way down. The raw remained the same. So if you can equate PIP with dynamic, plat with static, and raw as the difference between PIP and plat in general for trending purposes, then you should be able to identify the trends that are given on the exam in the tables and in any like graphic illustrations, right? And then for your raw, just understanding that the flow component is important, and increasing and decreasing flow can have an impact on the actual airway's resistance. Hopefully this helps. If you have any questions, let me know. Go ahead and play with these. Play with the numbers. You know, if one thing stays the same and the other changes, what happened? You know, where's the issue? Is it a dynamic compliance issue with the PIP? Is it a raw issue, which usually equates to increased PIPs in general? Or is it a true lung compliance issue? Is the plateau fluctuating? And always remember that it's an inverse relationship between the compliance and the pressure, either PIP or plat, because um, if because the pressure required to ventilate a certain volume in volume control is dependent on the compliance of the lungs. Thank you.